Today's video is for anyone that's noticed that something's going on with their feet. They've got a new rash, it's smelling a little bit, it's a bit itchy, it's peeling, they're not sure what's going on. Well, in this video, I'm going to cover the essentials of what you need to know. What is athlete's foot? Athlete's foot is also called, and this is a fungal infection that usually starts between your toes. It loves warm, moist, sweaty environments, which makes between our toes a perfect target. Athlete's foot is very common, especially in people who sweat a lot, wear tight, non-breathable shoes, and use shared showers like after swimming. Let me tell you about my patient called John. John came to see me last week. John is 38, he goes to the gym 4 times a week, and he works in long shifts in hospital. A few weeks ago, he noticed a rash between one of his toes. It looked like this. He also noticed he was having some itchy and some burning type sensations that came along with it. He had tried a powder he bought from the pharmacy and a cream he also bought from the pharmacy. The rash wasn't going away, and that's why he came to see me in clinic. Classic symptoms to watch out for. Well, in John's case, he had similar symptoms to what most of us will experience with athlete's foot. His symptoms were some itching type sensation around the rash, cracked, peeling, and sometimes bleeding skin, redness in the area, and in some cases a bad smell. What are the causes of athlete's foot? Well, as I mentioned earlier, it's a fungal infection. It's caused by a fungus called fungus like this thrive in certain types of environments. Damp locker rooms, tight shoes with no airflow, skin that stays wet after showering, and wet socks and shoes. In John's case, he was doing 12-hour shifts in the hospital and then going for a workout in the gym. After the gym, he generally goes to pick up some food and then heads home. And that means he's been wearing the same shoes and socks all day, including after the gym, and not changing out of his wet, sweaty socks post-workout straight away. What happened when John came to see me? Well, when you book in to see a doctor, we'll normally examine the rash, ask you a lot of questions, and in some cases, we may need to do some tests. In John's case, it was a classic case of athlete's foot. So then I gave him the following treatment and advice. Number 1, let your feet breathe. I advised John to get new pairs of socks which are made from cotton. I also recommended that he might need a few pairs of shoes which are breathable and easy to walk in all day, but don't trap in all the moisture. Tip number 2 is to make sure his feet are dry. If John went swimming or did a workout, I advise him to make sure he thoroughly dries his feet, especially between his toes, so moisture isn't sitting there. I also advise John to change his socks immediately after he works out. Tip number 3, I prescribe John an antifungal cream. If you have classic symptoms of athlete's foot, you can also speak to the pharmacist and find out what you can buy over the counter. Creams you might be able to buy include how to apply the cream. Well, you apply the cream on clean, dry feet, using the cream for around 2 weeks until the rash is completely resolved. If the treatment doesn't work, if the rash hasn't gone away in 2 weeks or it's getting worse, it's important to see a doctor. We may need to prescribe you some antifungal tablets, you may need a different antifungal cream, and you may need testing on the rash to see if it's a bacteria or a fungus or something else that's going on. There are other conditions like eczema and psoriasis which can also affect your feet. And that's why it's important to see a doctor, especially if the rash is not improving, so we can make sure we know exactly what's going on. Important things to watch out for and see a doctor urgently. If you've noticed there's fluid or pus coming from the rash, if you've got a temperature, if it's hard to move your toes and you're experiencing a lot of pain, you have diabetes or another condition that affects how well your body heals itself. I hope you found this video useful. Please write a comment down below and click subscribe for more useful health videos. Thank you for watching.